All right, so let's, we've talked a little bit about injury, and I wanted to try to focus this a little bit on climbing. Like for the average climber, how do they know when they're getting into the dangerous realm, when their structures are changing, the structure of their body is changing because of the activity of climbing, and might be leading them down the path of overuse injury?
I think for the climber out there who's trying to figure out, well, is their sport changing them, and is it going too far, or is it getting close to maybe, being increasing the likelihood of injury? And I think the simplest and most pragmatic answer is simply that if you start to notice that you can no longer function as efficiently in your everyday activities or nightly activities, and that you have to modify things, or that you have discomfort when you do a push-up, something as simple as that, or when you push up out of a chair and the wrist extension and finger extension required to do that, and you feel your flexors in your forearm almost spasm out, that kind of response to me would say, my recreation or my sport is starting to cut into how I function in a daily activity. And with that, I think a push-up is a nice, simple, functional pattern that stresses and challenges trunk stability, and that it looks at how healthy is the upper extremity. Can your hand form to the ground or the floor or the wall, and can you push your body weight up? And if it comes to a point where you can't do that, I think that's something that I would be concerned about.
So I can definitely think of a couple of examples where you're talking, like the rock climber who goes grocery shopping and goes to put that gallon of milk in the refrigerator, and they can feel it in their wrist. Or when swinging a hammer, feel some tenderness in the medial epicondyle. When carrying grocery bags home from the store, do they grab them with the whole hand,
right,
or do they thread different fingers through and go, "Oh, that that hurts. I can't do that." Simple actions like that, I think, can reveal where climbing is causing us pain or a lack of functionality. But when you see that happen, when you start to see that pain, I think a lot of climbers, frankly, might ignore it or not understand that it's significant.
Right. And I think that's a demonstration of that slow adaptation that's occurring over time and repetitive use. You must understand that neurologically, the flexors of the body, being in the fetal position, those are the strongest muscles.
When can a climber know that they've lost the balance, that their flexors are overpowering their extensors?
I think when you start looking more like an ape, when
your fingers curled in.
Yeah, that's right. Right.
Yeah.
When you look like a therianthropic troglodyte, and you're dragging your knuckles on the ground, and your hands are more flexed most of the time than they are, neutral or extended. Mm-hmm. I guess that's more of a joke. I guess I'm relying on comedy to try to evade the question. I don't think there is, certainly there is no, standardized way of saying, look, you've gone too far. But I think if you're starting to have discomfort and pain in that medial aspect of the elbow, or if, like I said, you can't do a push-up because you have discomfort or pain, then I think it's time that you seek medical treatment, medical advice, and that you try to obtain some balance back into your upper extremity.
Well, I think that's great, and the idea, I hope the take-home message that our listeners will get is that there's no pain too small.
Absolutely, without question. It's important for my clients, and I think for the general public, to differentiate between sensations. If there's sharp, annoying, deep pain, then that's something that warrants that you go and seek medical attention. If it's in the muscle belly, and it's that sort of like good soreness, that's delayed onset of muscle soreness, DOMS, and that's fine. That's okay. And I encourage you to get as much of that as you can in your lifetime. You've got one body, use it, and get all the DOMs that you can get. And so when it comes to that sort of thing, I think that's fine. Obviously, if you get rhabdomyolysis and you're vomiting and your urine turns brown because protein is degrading, like a lot of CrossFitters experience, then that might be a little bit too extreme. But just to look at how much is enough, and keeping that balance is critical. And so, if it's sharp pain, then you gotta seek medical attention, because it's just not worth the risk of avulsing a tendon or injuring a ligament, because then the time you spend away from your love of climbing is very costly. When if you get to the right medical professional who gives you sound advice and good warranted medical treatment, then you can be back on that wall and theoretically pain free and dysfunction free, and that's where we all want you to be anyway.
Okay, so that brings me to another topic. Climbers as a group, we tend to distinguish between muscles and tendons and ligaments, and we talk a lot about strengthening tendons and strengthening muscles in a way that suggests they're two different things. And I was wondering if you could comment on that a little bit. Now,
well, muscles and tendons are connected. They are the same unit, and so to say that a muscle can get stronger, more durable, or more resistant to injury or fatigue versus a tendon really isn't true. If a muscle gets stronger, then the tendon is going to be getting stronger as well, based upon Wolff's law, that if stresses are going through the tissue, and since the muscle and tendon are joined and they function together in a series elastic component, then they're going to develop the same. Now, I understand how that could be a common theme in the climbing sport, because the muscles in the hand and the fingers, they're pretty far away from the muscle belly. The tendons are a good distance away, and so if you avulse a tendon, or if you injure and maybe sever a tendon, I can see how the focus, perhaps kind of the bro science in the weight room, or the climber science, in the gym, the rock climbing gym, is to say, well, how do I get my tendons stronger? And I think again, the idea of working on some extension, I think is probably the best way that you're going about to do that, to get balance, because obviously the flexors are already very, very strong. And so making sure that the program design that you have hopefully are following, of course, if you're really hardcore and into this sport, that you're not jumping too quickly into advanced maneuvers, or that you're progressing your time on the wall so quickly. The analogy for runners, because I see more runners, is shin splints. And in my opinion, shin splints, or medial tibial stress syndrome, is really a problem of program design. That folks are progressing too quickly, or they've taken a leave of absence, and when they jump back in, their mind is in a different place than their body is, and so they don't respect those early warning signs, of discomfort or pain, kind of mild pain, and then they go for that next big run, and they come home and they're in such awful pain that they can't walk, or they get up in the morning and they have plantar fasciitis. Those types of activities is really a program design issue. When it comes to ligaments, you could do, I guess, some maybe extra stress on a ligament. What comes to mind is more of like the ACL, and I've heard of, for example, like skiers doing some activities to try to increase the shear forces in their knee joint prior to the season or sport, just to try to prepare a joint for the stresses of moguls or black diamonds and so forth. I don't know if there's really much validity or to that. So again, I would just focus on being the best climber that you can be, being technically sound, and having a solid program to go by. Because if you don't have a plan, then you're planning to fail.